The following is for informational purposes only. For medical advice, please see a medical professional.
Welcome to Staying Alive with Margaret and Susie. And Susie's not here, but she'll be back next time, we believe. And in the meantime, we can welcome back Jennifer Ashby, who hopefully you saw in the last episode. And we're going to continue to talk about integrative medicine and, in specific, acupuncture, because I was working with Jennifer on inflammation in my body, and 3 or 4 years in, I got a cancer diagnosis. And so I knew just who to go to. She could take care of me, and her colleagues could take care of me for all the things that she's mentioned in her previous episode. And my body loves acupuncture so much. I knew from working with her for years how relaxing it was for me. I literally slept sometimes. It had the most calming, relaxing, energizing effect. And so I wanted to start out, Jennifer, by asking you, what exactly does acupuncture do physiologically in the body? Is it different for everyone? You know how my body responds. Maybe not everyone's body responds that way. What does it do?
Well, I want to, can I preface a little bit about just
Yes, whatever
framing
you'd like.
and so that people understand that like the information that I'm giving is super valid. So in the state of California, we are primary care providers. Very few people know that. We have pre-med to begin our education. Then it's a 4-year master's program after that with like, I don't know, it's like 1,800, 2,000 hours of clinical work. And then we have to pass a state board exam. So we bill insurance for those of us who take it. I mean, we're primary care. So then on top of that, I have a clinical doctorate, which was another almost 3 years of study I did my residency at Shanghai University in China and at Marin General
Mm.
Hospital, actually. So acupuncturists in the state of California, at least I can speak, whoever you see has a very basic, safe understanding. If you're going for something specific, there are a lot of people that specialize as well. So you can go in and find someone, whether it's pain, whether it's oncology, whether it's women's health. I'm part of the nephrology department at UCSF, where I am part of the Polycystic Kidney Disease Center of Excellence.
That's
So there's
right.
lots of clinicians that specialize in lots of things. So it used to be thought that acupuncture just stimulated some points, but they really had no idea what was going on. And to study acupuncture is so silly to acupuncturists because it's like one of 12 modalities in Chinese medicine. Like nobody walks in a room and like shoots darts of acupuncture into somebody and walks out. That's just not the way it's going. So at places like UCSF, where I don't have a full herbal pharmacy, I can still do, which is really the only thing I can't do there, right? There's the patient practitioner relationship, there's the acupuncture, I can do electrostimulation, I can do gua sha, cupping, moxibustion. So there, I still get to do a lot of the and tuina, our type of manual massage. There's a lot that we can still do there. But people study just acupuncture. It's literally like cutting a finger off a hand and studying to see if the finger works as a finger.
Hmm.
So that any research shows efficacy in acupuncture treatment isolated alone is such a kudos to acupuncture itself because it's
Yeah.
never meant to be practiced by itself. So um, so this idea of how what acupuncture does has the research has shifted the ideas about it really dramatically, especially over the last 30 years. It no longer thinks of it as just stimulating certain points on the body, but instead it thinks of it in terms of neuromodulation. And that means it has a way of affecting the nervous system, the
Yeah.
immune system, your endocrine system, and then local tissue physiology.
That's so interesting. Like I could tell as a recipient of it that I hope that it was affecting my endocrine system and such, but the feedback of the nervous system, I could tell how much it was helping my nervous system.
Yeah.
I mean, I could feel that immediate. I don't know if everyone does, but it was really clear to me, oh, this is great for my nervous system.
You're one of those great responders. I mean, I think that even when people, so it's interesting. So I'm actually the first author in a Western peer-reviewed journal article for a protocol that I wrote with my team at the Osher Center for reducing cancer-related pain for an inpatient population. And one of the things that I've learned is that the effect on the nervous system is so great that whether the pain itself is actually measurably reduced or not, a person's experience of the pain when their nervous system is relaxed and not just in reaction to the pain being triggered, will give them pain relief. Does that make sense?
Yeah, can we talk about that a little bit
Mhm.
more? Because um, I know people who've gone through cancer surgery who are experiencing pain and they're somewhat fearful to use acupuncture, like somehow that's gonna maybe spread some cancer cells or somewhere else or something. So it just helps so much with the pain. I would hate for anyone to deny themselves acupuncture because I find it so useful for pain.
So I think that that is a very common experience and misconception.
It's total misconception, right?
And I also believe that working with someone with experience is really important. So there's what they're worried about, and I think what you're describing is something called seeding. So if you needle toward the area of cancer, you then help spread, you disrupt whatever is encapsulating the cancer cells where they currently are, and you help spread it throughout the body. I think that people worry about their lymphatic system also being potentially stimulated, and that also spreading cancer. And
Is
people,
there any evidence of that?
not really. I mean, if
No.
I were to go in, people fall on either sides of the coin because it's not binary, right? Like if I go in close to a tumor and I'm needling around the tumor, which is actually an ancient Chinese method that nobody uses here in the state
Right.
of California, that would
Right.
be illegal. Um, yes, you could stand the chance of seeding, but nobody does that. So for example, with the protocol that I wrote, most of the points are on the limbs because it was mostly thoracic, like your trunk cancers, brain or trunk. Um, and when you are working with a clinician that understands the nature of cancer and their treatments, you are working with someone that is there mostly to support your own innate immune system, um, to support the efficacy of the treatment itself. We're not trying to like detoxify while someone's in chemotherapy. That would be antithetical to the treatment itself. We're not reducing efficacy, right? So
Right.
we're supporting what a person has chosen to do. So I do think it's a misnomer when you're working with a clinician that has experience in oncology.
Yeah.
And seeding, we don't needle areas of cancer. We have so many roads to Rome in East Asian medicine. We don't need to.
Right. So when you're working with an oncology patient, what are you focusing on? Primarily pain, nausea, what else? Like,
I mean, I'm working on whatever's needed. I mean,
yeah.
what insurance covers is pain, nausea, and vomiting.
Okay.
So what we call neuromusculoskeletal pain. So neuropathies, pain in the limb if somebody's got like a sarcoma in a bone. I mean, there's so many different pains that come with cancer and its treatments, whether it's caused by the cancer or the treatment itself.
Right.
So I am mostly boosting a person's chi, their energy inside their body. I help with trouble with when if people have like their appetite is so low that they can't eat. We're trying to stimulate appetite. If they have diarrhea from treatments, we're trying to reduce the diarrhea so that they don't become too dehydrated. The nausea, vomiting, and pain, of course. I mean, I'm there for the anxiety, the sadness, the anger, whatever they're facing. I have an approach for. We all have an approach for.
Yeah.
So we treat the whole person.
Let's hear a little bit more about the chi, like because that is so critical. We haven't really talked about that yet. So you're boosting the chi.
We're both so
Explain to people what that is and what that
are.
does for health.
So chi
And
itself has no interpretation in English.
mhm,
So we use the word energy because we
energy.
don't have another word, but energy by nature can be measured and chi cannot. Chi can be assessed, but not actually truly measured. If you think about a yin and yang symbol, that is about the chi or the energy of yin and yang that are interdependent, codependent, they're constantly transitioning into each other. And that is the balance and the nature of our bodies. It reflects kind of how nature balances itself as well. Not all good is bad, not all light is, all light has some dark. Like everything has components of itself within it. It is the balance of the universe. It all came from the concept of the Tao, which is the way, which is actually existence, and that the inherent nature of everything is balance. So, when you're working with an East Asian medicine practitioner, I think the best way to understand what we do is we have this very unique set of skills to diagnose where your imbalances lie, and we've all got them, right?
Sure.
And then through that, try to recreate homeostasis or balanced physiology. So, if we can all agree that a person's body will return to a state of homeostasis or balance if it can, given the opportunity, then you understand the complete foundational theory of East Asian medicine in its entirety. So that's all we're trying to do, figure out where you got wacky and do our best to get you back to center. And in oncology, just to completely answer your question, we have to recognize the constitution of the person, the effects of the drugs, and then take into account the symptoms that they're experiencing, again, understanding the nature of the cancer and the cancer treatment. So we have to be able to basically translate the effects of both the disease and the treatment into East Asian medicine terms. Then we listen to you really in depth about what you're going through, and we are coming to our own conclusions. Then we feel 9 pulses on each wrist that correlate to all your internal organs.
And
We look at the tongue, and the tongue is a
I had to
map.
get that out in an episode. Yeah.
The tongue is a map of all your organs. And so we take all of this into consideration to come up with a treatment and a treatment plan. In terms of the evidence base of all of this and studying acupuncture, MRIs that study that show activity in the thalamus, the hypothalamus, the insula, the anterior cingulate cortex, the amygdala, and the prefrontal cortex. And these are the areas that we attribute to pain perception, emotion, stress, and autonomic regulation. And those were studied while people are receiving acupuncture.
And scientifically proven to
Mhm.
make a difference.
Yeah.
That's wonderful.
It also does this acupuncture stimulates the release of endorphins, right?
Yeah.
And so this endogenous kind of opioid effect for acute and chronic pain is also a really popular um, um, it's a popular reason why people come and seek acupuncture. And studies have shown that blocking the opioid receptors like acupuncture do reduces some of the effects that they see that acupuncture does. So if you block it, acupuncture is not as effective in research studies.
Wait, say that again.
So it triggers endogenous opioids
Right,
on its
right.
own. So when you're doing research and you block those and you do the same points, the acupuncture is not as effective,
Oh,
proving
interesting.
that it triggers endogenous opioids. Yeah,
Mhm.
that's pretty cool.
It's really cool.
But it also affects like neurotransmitters, right? So in East Asian medicine, we have the school of the spleen and stomach, which you can translate like the gut microbiome. And we know now that like I think it's 90% of your serotonin, which is your happy hormone, is produced in your gut.
Mm-hmm.
So acupuncture itself affects serotonin because we do a lot through just balancing digestion as a means of keeping someone strong. It affects dopamine, norepinephrine, and GABA. So that We think that that's the explanation as to why acupuncture is so good in helping treat anxiety and depression, insomnia,
Yeah.
chronic stress, and chronic pain. So it changes the experience of pain by influencing all of these neurotransmitters as well, not just because it's affecting with these endogenous opioids, but also because it affects neurotransmitters.
That's great. No wonder I'm such a healthy, happy, getting good sleep, aging person because my gut
Mhm.
is good, much more so than a lot of people
So important.
after a certain age. So in an ideal world, like um, acupuncture would be covered by medical insurance and Medicare in this country. Like I'm like living for the day. Like that's going to happen in my lifetime
So
if
Medicare
I
does
can will it.
cover it for one thing,
Oh, tell us.
back pain, if the acupuncture is done by an MD.
Wow.
And many, many, many insurances have acupuncture coverage now.
Oh, that's great.
There is a problem, and that there is one third-party company that has taken over for many of the major medical insurances, saying like, "We'll take acupuncture off your hands. We'll deal with it." It's called American Specialty Health, and the problem is that it runs like the worst HMO ever, and the reimbursement rates are so suboptimal that
Mm,
acupuncturists can't afford to take it and live,
yeah.
and it's
Oh my
killing our
God.
profession, actually.
Oh, I'm so sorry to
It's
hear that.
really sad. I feel sad
So,
both for acupuncturists and patients whose companies have signed up to provide them with acupuncture coverage, and yet
yeah.
nobody can take it because they can't afford to take it.
Yeah. I mean, I know for me, when I had, when I was in the throes of cancer treatment, I prioritized my finances over coming to you every 2 weeks. But now that I'm healthy, I'm like, oh, it's expensive, right?
Listen, as long as you're practicing all the things that you and I spoke of all those
Well,
years,
yes,
then
but
you're
but
doing okay.
I know I'm always better with you, always better with you. So
I'm better
in
with
the best of all possible worlds, how often would you suggest that a fairly healthy but aged person um, receive acupuncture?
every 2 to 4 weeks,
Yeah, yeah,
depending. I mean, if you're going into
that's what
like
I would
cold and flu
like.
season, if you know that you're going to travel to a place where you might get sick, you might like
Right?
boost up a little bit before you go.
Yeah,
If you're going through a more challenging time in life, that is another time. I mean, based on all those scientifically proven components of what acupuncture does, right? So it lowers heart rate. It takes people out of fight, flight, freeze. That's one of the reasons it's really good for early cancer journeys too, is it helps people kind of re-embody themselves by
yes,
enhancing that parasympathetic rest and digest response.
that's what it
But
did. Yep.
the physiological changes, especially for stress, it lowers heart rate. It improves heart rate variability, right? Because
Mhm.
your ability to manage the stress that's there is better. It reduces stress hormone output, so you're not dealing with the excessive cortisol, epinephrine, norepinephrine output. And it improves your digestion, which boosts every system in your body, and it helps you maintain better sleep more regularly, which also boosts every system in your body.
Oh yeah, I love acupuncture.
Too.
Yeah. I think that that's a good place to leave it. Anything
Great.
else? Yeah, I think that that's good. And please like and subscribe. And thank you so much, Jennifer.
Thanks for having
And
me. It's so good to
oh,
see you.
thank you so much. And Susie appreciates it too. I'm sure
Yeah,
she's
a
gonna love this.
speedy recovery to see.
Until next time, we are staying alive.
You've been listening to Staying Alive with Margaret and Susie. This show is hosted by Margaret Cooley and Susie Hymas. To subscribe to our show, leave a comment or ask a question, please visit stayingalivewithmargaretandsusie.com. Our podcast is available on all major podcast platforms. If you've enjoyed our program, please feel free to leave us a 5-star review. Thanks for listening.